Hello friends, my name is Chaturshi Chordia. My roll number is 31 and I am from second year MBBS. My topic is non-steroidal anti-inflammatory drugs. The topics to be covered are NSAIDs and prostaglandin synthesis inhibition, salicylates, propionic acid derivatives, phenamate, enolic acid derivatives, acetic acid derivatives and pyrazolones. So what are non-steroidal anti-inflammatory drugs? These are a class of drugs that have analgesic action, antipyretic and anti-inflammatory action. There is no CNS depression, they do not produce physical dependence, there is no abuse liability. Therefore, they are also called as non-narcotic, non-opioid, aspirin-like analgesics. They primarily act on peripheral pain mechanisms but also in the CNS to raise the pain threshold. Now the NSAIDs and prostaglandin synthesis inhibition. So the main mechanism of action of NSAIDs is inhibition of prostaglandin synthesis. So as we all know how the normal prostaglandins are formed. The membrane phospholipids is acted upon by phospholipase A, then arachidonic acid, and arachidonic acid undergoes further metabolism by cyclooxygenase pathway, which produces thromboxane A2, prostaglandins and prostacyclins. So the COX-1 derived prostaglandins are normally present in the body. They are physiological housekeeping function, and the COX-2 derived prostaglandins are present in minute amounts. They are induced by cytokines and they occur at the site of inflammation. Now, due to the inhibition of prostaglandins, there are certain beneficial actions and also certain toxicities. So the beneficial actions are analgesia, that is, it prevents the pain, nerve ending sensitization. It is also antipyresis. It also produces anti-inflammatory reaction. Then it is antithrombotic and it also does the closure of ductus arteriosus in newborns. Now the shared toxicities or the non-beneficial actions of prostaglandin synthesis inhibition is they produce gastric mucosal damage. There is also bleeding, that is inhibition of platelet function. So there is prolonged bleeding time. Then limitation of the renal blood flow so that sodium and water retention occurs. Then delayed or prolongation of labor, asthma and anaphylactic reactions in suspective individuals. Now there are some certain groups of drugs which comes under non-steroidal anti-inflammatory drugs. Now the first group is the most important, that is the salicylates. Salicylates, the aspirin is the prototype of this drug. It is acetyl salicylic acid. When aspirin is metabolized in the liver, it is converted into salicylic acid. Now, there are certain pharmacological actions of aspirin. So, first action on GIT is that it irritates the gastric mucosa. It produces epigastric distress, nausea and vomiting. It produces analgesic, antipyretic and anti-inflammatory reactions. That is, it is a weak analgesic. It reduces fever by promoting heat loss. It's anti-inflammatory action at high doses. Then on blood, it irreversibly inhibits TXA2 synthesis, which interferes with the blood platelet aggregation, and then bleeding time is prolonged. Then glucose utilization increases, respiration is stimulated, which tends to wash out CO2 and produce respiratory alkalosis, increases cardiac output indirectly. The pharmacokinetics, aspirin is absorbed from stomach and small intestine. As it is poorly water soluble, it is the limiting factor in absorption. Now it is rapidly deacetylated in gut, liver and plasma to release salicylic acid. It is 80% plasma protein bound. It has slow entry in the brain. It freely crosses the placenta. It is conjugated in liver with glycine to form salicylic acid. It is excreted by glomerular filtration and tubular secretion. Plasma half-life is 15 to 20 minutes. Now the adverse effects. There are certain side effects like nausea, vomiting, the common ones. Then hypersensitivity and idiosyncrasy, which includes rashes, urticaria, rhinorrhea, angioedema. Then at inflammatory doses, aspirin causes a syndrome called as salicylism, which is represented by dizziness, tinnitus, vertigo, reversible impairment of hearing and vision, excitement, hyperventilation, electrolyte imbalance, And then acute salicylate poisoning is also an adverse effect of aspirin. Now the uses of aspirin. Aspirin is used as an analgesic and antipyretic, mostly used in headaches, backache, myalgia, joint pain, toothache and dysmenorrhea. It is also used in acute rheumatic fever at the dose of 4 to 5 gram or 75 to 100 mg per kg per day, which brings a symptomatic relief. It is also used in rheumatoid arthritis in the dose of 3 to 5 gram per day, which produces relief of pain, swelling and morning stiffness of the muscles of the joints. And then osteoarthritis, it affords symptomatic relief. Or it is also used in post myocardial infarction and post patient strokes. It also prevents preeclampsia. Then precautions and contraindications that are to be considered. It is contraindicated in persons who are sensitive to it and those who have peptic ulcer or bleeding tendencies. Then it is also contraindicated in children suffering from chickenpox or influenza. It should be avoided in diabetes. It should be stopped 1 week before elective surgery. It should be avoided in breastfeeding mothers and also in the individuals who have G6PD deficiencies. Then the next group of drugs is propionic acid derivatives. The ibuprofen is the first member of this group. All members inhibit prostaglandin synthesis, and naproxen is the most potent drug in this group. The adverse effects are gastric discomfort, then nausea and vomiting. CNS side effects might include headache, dizziness, blurring of vision and tinnitus. Hypersensitivity reactions are also adverse effects of propionic acid derivatives, and it should also be contraindicated in peptic ulcer patients. Pharmacokinetics, they are absorbed orally, highly bound to plasma proteins. It is used with anticoagulant should nevertheless be avoided. They decrease diuretic and antihypertensive action of thiazides, furosemide and beta blockers. Enter brain. They enter in synovial fluid and also they cross the placenta. They are metabolized in liver by hydroxylation and glucuronide conjugation. It is excreted in urine as well as in bile. Then ibuprofen and naproxen are the two members actually. Now there is a comparative table you can say about ibuprofen and naproxen. So ibuprofen, it is rated as safest traditional NSAID. 40 mg relieves surgery and dental pain. It is a weaker anti-inflammatory drug. It is available as an over-the-counter drug, widely used for rheumatoid arthritis and osteoarthritis. It is also indicated in soft tissue injury, fractures, vasectomy, teeth extraction, etc. Naproxen is stronger compared to ibuprofen and is particularly potent in inhibiting leukocyte migration. It is also recommended for rheumatoid arthritis and ankylosing spondylitis. It can effectively suppress the platelet function. Gastric bleeding is more common than in ibuprofen. Dose should be reduced in the elderly. Other drugs in propionic acid derivatives are ketoprofen and flurbiprofen. Now, phenamides is the other group of drugs, also called as anthralanic acid derivatives. Now, mefenamic acid is the drug here. It is an analgesic and antipyretic and a weak anti-inflammatory drug which inhibits the synthesis of prostaglandin. Its adverse effects, the main adverse effect is diarrhea. It is a dose-related side effect actually. Also hypersensitivity reactions and CNS manifestations are here. Hemolytic anemia is rare, but it is a serious complication with phenamides. Pharmacokinetics, now the oral absorption is slow. It is highly plasma protein bound, partly metabolized, excreted in urine as well as in the bile, and the plasma half-life is 2 to 4 hours. Its uses, as usual, analgesic in muscle and joint soft tissue pain, where strong anti-inflammatory action is needed, effective in dysmenorrhea. Now, next group is enolic acid derivatives, also called as oxycams. Two drugs are important in this group, piroxicam and tinoxicam. They are long-acting, potent NSAIDs, good analgesic antipyretic action, non-selective reversible inhibitor of COX, and it lowers the prostaglandin concentration in the synovial fluid and inhibits platelet aggregation, prolonging the bleeding time. Now, pharmacokinetics, it is rapidly and completely absorbed, 99% plasma protein bound, largely metabolized in liver by hydroxylation and glucuronide conjugation. It is excreted in bile and urine. Enterohepatic circulation occurs in this, and plasma half-life nearly 2 days. Then adverse effects, as usual, ulcers and gastrointestinal bleeding with frequent high doses. Then rashes and pruritus are seen, and edema and reversible azotemia is also seen. Its uses are for long-term inflammatory reactions like in osteoarthritis and rheumatoid arthritis and ankylosing spondylitis. Also used for acute gout, musculoskeletal injury, and in dentistry. The next group of drugs is acetic acid derivatives. The drugs here are ketoconazole, indomethacin, and nebumetol. So here's a short review about all these drugs. Ketorolac is a potent analgesic but is modest in anti-inflammatory activity. It is rapidly absorbed after oral and intramuscular administration. It is highly plasma protein bound and excreted in urine. The major metabolic pathway is glucuronidation. Plasma half-life is 5 to 7 hours. Adverse effects, as usual, like nausea, abdominal pain, dyspepsia, ulceration, loose stools, drowsiness, and headache. Uses, it is in post-operative dental and musculoskeletal pain. Then indomethacin, it relieves only inflammatory or tissue-related pain. Now, it is well absorbed orally. It is 90% plasma protein bound. It is partly metabolized in the liver to inactive products and excreted by kidney. Plasma half-life 2 to 5 hours. Adverse effects, gastric irritation, nausea, anorexia, gastric bleeding, headache, dizziness, mental confusion, hallucination, leukopenia, and rashes. Uses in it is used in ankylosing spondylitis, psoriatic arthritis, and acute gout or rheumatoid arthritis. Nebumetol, it is a prodrug. It generates an active metabolite 6-methoxy naphthyl acetic acid, that is 6-MNA, which inhibits COX-1 and COX-2. Analgesic, antipyretic, and anti-inflammatory activities are seen. And treatment of rheumatoid and osteoarthritis as well as in soft tissue injury. Adverse effects are abdominal cramps, diarrhea, rashes, and photosensitivity. Plasma half-life is 24 hours. The last group of drugs is pyrazolones. It is the drugs here are phenylbutazone and oxyphenbutazone and propylphenazone. Now here's a comparative kind of table between them. Here the phenylbutazone and oxyphenbutazone is a potent anti-inflammatory drugs. It inhibits the COX. Then gastric toxicity is high. Edema due to sodium and water retention is frequent, and CNS side effects, hypersensitivity reactions, and hypothyroidism also occur. They have gone out of use due to risk of bone marrow depression and other toxicities. Now propylphenazone, it is the only pyrazolone still available in India. Fast onset and analgesic, antipyretic, and anti-inflammatory action. It is marketed only as over-the-counter antipyretic and analgesic FDCs. For self-medication, headache, body ache, and toothache and fever, this drug can be used. So now at the end of the session, I would like to continue with some MCQs. So the first MCQs is aspirin inhibits. So the answer for this MCQ is C, cyclooxygenase. Then second, what is the primary mechanism of action of NSAIDs? So the answer to this question is option number C, inhibition of prostaglandin synthesis. What is then third? Which of the following is a common side effect of NSAIDs? The answer for this question is option number B, that is gastric ulcers. Moving on to question number 4. Diarrhea is most important dose related effect of. So the answer to this question is option number D, that is Fenamate. Then fifth, aspirin is conjugated in liver to form. The answer to this question is A, salicylic acid. Thank you.